Today is episode 5 of our Know Your Options bonus episode series, and we're going to be talking all about how you can reduce the risk of tearing and protect your perineum during birth. So if you want to get the free download from today's episode, which has great information about perennial massage and other resources that we mentioned, just head over to thebirthhour.com/bonus5, and that's the number 5. So thebirthhour.com/bonus5. All right, now I'm going to go to my discussion with Stephanie Spitzer-Hanks, who's a doula, childbirth educator, and lactation consultant, and I am Bryn Hunt-Palmer, the host of The Birth Hour. All right, we are back with another bonus episode of The Birth Hour, and this week we're talking about reducing the risk of tearing in a vaginal birth, and Stephanie has a lot of experience with this. I have personal experience with it where it didn't go so well, and have a lot of questions from moms who are concerned about it or maybe had a lot of tearing with their first and want to prevent as much as possible with their second. So I'm going to turn it over to you, Stephanie.
Yeah, this is a big one, and it's a big fear factor for a lot of women, understandably. But yeah, there are some things that we can do to reduce the risk of tearing. There's not any way to eliminate tearing for most people. I think most women are going to tear a little bit. It's just sometimes it needs to happen. So I don't want you to feel like you failed somehow if on the other side of this you end up with a tear that you did something wrong. I mean, sometimes it's just the way babies need to get out. But there are a number of things that we're going to talk about now that we can do to kind of reduce the risk. So number 1 on my list is care provider. Y'all will hear me talk about this over and over. Choosing a care provider is going to determine a lot of things about how your birth goes. And the fact is that not every care provider is skilled or really inclined to try to keep your perineum as intact as possible. I had a client one time asked her care provider, so how often do you episiotomies? And her OB actually said to her, well, everybody gets a little cut. My eyes just about popped out of my head when she said that. I can believe she said it. I mean, I could believe she did it, unfortunately, but I can believe she said it. But so she changed care providers, which was a good choice on her part, in my opinion. So if your care provider has an episiotomy rate that's higher than like 5%, I would be asking some questions about that. So episiotomy is going to be a big thing that's going to cause tearing because episiotomies tend to cause further tearing beyond the cut to your perineum. So you definitely want to be asking about that and what your care provider does to try to protect perineums typically.
Do you ever give the example of like tearing fabric? I love that one.
Yes, I show it in the course. Yes.
Yeah. Basically, like if you think about cutting a little nick in fabric, you could easily tear it across. But if you try to just tear fabric without a cut, it's not possible.
Right, it's a lot more difficult.
So the episiotomy basically gives your skin the permission to start tearing.
Everyone is cringing right now.
Yeah.
All right. So you want to avoid episiotomy if at all possible. Sometimes it is necessary. So I want to say, so that's why, it's not realistic to find a care provider with a 0% episiotomy rate. Like sometimes it's necessary, but having it be as low as possible is what your goal is.
I would also say this is one of those things that's changed over time, and so your mom may have had an episiotomy, and it was probably normal practice at that time. Yeah. My mom had, 4 unmedicated births, but she had an episiotomy with every single one of them, which, if you've had 4 babies, you certainly don't need one by the 4th. But it was just what was done, and she completely just, trusted the doctor that was what was needed, and that's changed with a lot of things in obstetrics,
yes.
A lot of things change over time when we, learn more evidence-based practices. So
for sure,
don't just listen to what your mom or
I've heard moms and grandmas say, "Well, isn't it better to have an episiotomy?" And I'm like,
because it's an easy to stitch back up.
That's what the thought was, among other things, but
right.
Okay, so avoiding episiotomy, if at all possible, and finding a care provider who works to try to protect your perineum is at the top of my list. The position that you use for pushing can contribute to tearing. So the worst positions as far as tears go are on your back or even like kind of in a semi-reclined position, and which is what most people do in the hospital. And also, squatting can have more significant tears. And when you think about having just that amount of pressure that you're putting on your perineum in a squatting position, it kind of makes sense. So I love squatting for pushing, but typically at the point of crowning, it might be a good idea then to sort of shift maybe onto your side. So side lying and hands and knees have been associated with a lower degree of tearing.
Yeah, I personally pushed my first baby out on a birth stool, which I feel like might even be worse than squatting on your own, just because things are stretched out so much more. But I did talk to my midwife afterwards because I had a lot of tearing, and she said that she, has moms get off the birth stool for that last push these days. And I also, was pushing really hard. I remember her telling me to kind of ease up on the pushing as the baby was crowning. But I had been pushing for so long that I was like, in my head, I was like, no, I'm going to keep pushing as hard as I have, but I want the baby out. So I'm sure you'll get into that a little bit as well.
Yeah, I was going to say, you're bringing me to another point I wanted to make, which was the slow birth of the baby's head. Okay, so when you can slow down at that point where the baby starts to crown, I mean, it's super intense. That's what that we call it the ring of fire, because there is a lot of burning that happens when that baby is stretching. Again, stretching is preferable to tearing, and it takes time for tissues to stretch. So you want to let your baby be crowning. I mean, again, if everything's great with the baby's heart rate and there's not a rush, it's good to listen to your care provider who tells you to slow down. or your doula. I do this as a doula. I'll remind moms now, okay, your baby's crowning. Let's let those tissues stretch. I know you want to meet him. I know you want to meet him right now, but it's going to be better for your tissues if you let this part be slower. So not everybody's able to hear that in that moment because it is very intense. But yeah, so the slow birth of the baby's head and the making sure that your care provider is also supporting a slow birth and isn't just getting in a hurry. Something that you can also do that is really been documented in the evidence is using warm water. So either laboring in warm water in a tub, or if that's not an option for you, then using compresses, warm water compresses. And I have my whole technique that I've sort of perfected over the past. I do. I should patent it, shouldn't I? But anyway, I'll give this to you for free. And what I do is I get my heating pad set up, and I go to the sink and get a stack of washcloths with warm water and kind of wring them out so they're damp, but not like sopping wet. I find a waterproof sheet, like a Chuck's pad, and put it in my heating pad, and then I fold it over with the warm washcloths inside. And I have that plugged in over to the side where I can get to it. Sometimes I get sort of trapped in, especially in hospital births, when all the people come in to catch the baby, the nurse, the baby nurse, and the OB, and the tech, and then the big table that they wheel up, and I can't get to the sink anymore. So I have my little stash over here that I pull out. And once, one gets dirty or, it cools off, then I can switch it out for another one. So that's what I do to try to help protect mom's perineums. I usually only do that if she's on her back or on her side, because if she's in another position, it's just sort of awkward for me to be reaching up in there. And those other positions tend to be more protective anyway. So warm water compresses. So figure out how to get the warm washcloths where you can use them. I also use gloves when I'm doing that, because when we talk about pushing, we talk about pooping also when that happens. So there's, it's not a clean area. So you want to I also grab a couple of gloves and have those over there too.
In addition to helping with tearing, I bet that just feels really good to relax the mom when she's pushing.
For sure. Yeah. A lot of women find it to be soothing. So that's something that I always offer. And then something else that you can do prior to labor is perennial massage, and you might have seen this, mentioned here and there. We have a nice little graphic that we'll be including in our download to show you how to do it. It's particularly helpful with first-time moms. For people that have had an episiotomy before, it can be helpful. And then for women that are over 30, for some reason, it seems to be better, more useful. So it's basically just some gentle stretching. Your partner can do it. You can do it to yourself with some sort of lubricant, coconut oil, olive oil, other kind of lube. Not really understood why it's helpful. Part of it might be getting sort of sensitized to that burning, stretching feeling, and then, not being afraid of that when the time comes. That might be part of it. It might just be mental, in addition to kind of preparing your tissues. I don't really know if that's possible or not, but it has been shown to be somewhat helpful. It's not a huge reduction in risk, but it's, anything helps usually for people. And then, one of the big things is having a baby that's in that ideal position where they've got their head tucked and they're not sunny side up. So doing what you can in the process of labor, and even during that process of pushing, to be moving into different positions to try to help the baby turn the better way, using a peanut ball if you have an epidural, but so that, because sunny side up babies tear more.
Yep.
Yeah.
Sure do.
So yeah. All right. So that's, that's kind of my quick list of things. I go into more detail in the course about some of the things, but yeah, those are things that you can try to do to reduce your risk.
Right, and we actually broke up pushing into 2 separate lessons in the course, right?
It's actually like 3 lessons.
Wow.
Because or maybe it's 4. I kind of was like, oh, it's starting to be like a 20-minute video. Okay, I probably need to break this up. So yes, I think I start with like a basics of pushing, and then I talk about things that can put your perineum at risk for tearing, and then I talk about ways to prevent tears, and then I talk about positions and breathing. And then I talk about knowing your rights in that same module too. So it's actually a pretty big one.
Pushing is one of those things that you really just can't predict.
You can't.
Some moms get the baby out in 2 pushes, don't tear at all, and others push for an hour. And it's just, I think, one of those things that you can't just put in your birth plan how you want it to go, because you don't know.
You don't know.
I love that you're covering all the
angles. Yeah.
Angles and how to, help it along.
Some babies come out quick. Some come out slow. It has a lot to do with their position. And I had a feedback mom this summer that pushed for 6 hours.
Wow.
What? She'd pushed for 4 with her previous one, and then had a cesarean based on just failure to descend. But turns out she probably has a really narrow pubic arch.
Yeah.
And it takes longer for her. So baby was in good shape. She was in good shape. So we just kept pushing, and she was really determined. She had that baby vaginally after 6 hours.
Yeah.
Yeah.
That's how much evidence is there behind mom's pelvic area being too small to have a vaginal birth.
There's not a lot of evidence behind that, because there's a lot of factors that go into that. Mom's pelvises do shift in labor. You can't predict how that's going to work. What different positions can be helpful. Squatting does increase the outlet. The baby also has a role to play in the baby's position and in the way that the baby's head molds. That's why babies have those terrible cone heads a lot of time at birth. Especially the longer you push, the bigger the cone head usually.
Back to normal.
You go, yeah, after 24 hours. That's what the hat is for. But yeah, those plates in the baby's head actually do mold to fit. It's pretty remarkable. But yeah, so there's a lot of different factors. You can't predict ahead of time so if your doctor is telling you your pelvis is too small, then you may want to look for a different doctor, because they can't tell that just by looking ahead of time.
All right, well, I think we're going to wrap that up. So the free download from this episode will have some of these tools, as well as a diagram of how to do the perineum massage. And then on our Facebook Live, Stephanie's going to actually be demonstrating that, as well as...
With a model, not a person.
We'll get kicked off Facebook. She has a model for that, but I'm excited to see that. It's also going to be in the course. And then in the Facebook Live, we'll also talk about things you can do postpartum to help with healing, which I am very passionate about that. I talk about it a lot on the podcast, so be sure to check out that Facebook Live. But the next bonus episode is going to be really focused on postpartum, setting boundaries and expectations around those people that you surround yourself postpartum. All right, I hope you got some useful information from that episode. And if you want to get that free download, which has tons of great information in it, head over to thebirthhour.com/bonus5. And if you know for sure that you want to sign up for the Know Your Options Childbirth course, you can head over to thebirthhour.com/course and use the coupon code 100OFF for $100 off your purchase. We'll be back with another bonus episode next time, talking all about setting boundaries postpartum.